So welcome everyone to tonight's program. I'm Shireen Ash, a librarian at the Corte Madera Library, a branch of the Marin County Free Library. And I am very, very pleased to welcome you all here tonight and to welcome our two speakers, two of the contributing authors of the Long COVID Survival Guide, How to Take Care of Yourself and What Comes Next, Stories and Advice from Long Haulers and Experts. So long haulers and experts they are. So tonight's discussion will talk about peer-to-peer support, emerging research, and the role of medical bias in long COVID experiences. This book is a support group in book form written by experts and long haulers. So with that, I will introduce Fiona Lowenstein, who is the editor. They're an award-winning independent journalist, producer, and speaker covering health justice, wellness culture, LGBTQ issues, and much more. Since the pandemic began, Fiona has been covering COVID-19 patient issues. In their 2020 New York Times op-ed piece on lingering symptoms was the first mainstream account about what we now call long COVID. Fiona's writing has been published in the New York Times, Teen Vogue, Vox, The Guardian, Business Insider, among other publications. They are the founder of Body Politic and the co-founder of the Body Politic COVID-19 support group. Fiona has served as a subject matter expert on long COVID for the NIH, CDC, WHO, and the POTUS COVID-19 Health Equity Task Force. Lisa McCorkell is a long COVID patient advocate and co-founder of the Patient-Led Research Collaborative. She's presented the Patient-Led Research Collaborative's work to Congress, NIH, CDC, President's COVID-19 Healthy Equity Task Force, and Lisa has co-authored research papers on long COVID. Lisa has a background in writing, policy analysis, and advocacy, and has conducted quantitative and qualitative research on issues in public health, criminal justice, labor and employment, digital equity, and more. Lisa has a master's in public policy from UC Berkeley and a bachelor's of arts in political science from UCLA. And unfortunately, our third guest and author, Karla Monterroso, was not well tonight and cannot join us, but Fiona and Lisa will do their best to represent some of the points that she was going to make. So with that, let's dive in. First of all, let's get a grounding of what we're talking about. So what is long COVID and how is it related to other chronic complex illnesses? Fiona, do you want to start us off?
So I'd love to hear Lisa answer this question as well, because Lisa is, of course, our researcher. But I'll just say briefly that long COVID is an umbrella term. So it does refer to, a diverse set of experiences and symptom clusters, but it shares similarities. Long COVID is not entirely new. Of course, it refers to chronic symptoms following a COVID-19 infection. And it shares similarities with existing complex chronic illnesses, including ME/CFS, which stands for myalgic encephalomyelitis, chronic fatigue syndrome, as well as dysautonomia, which is a chronic illness typically defined by some type of autonomic dysfunction of the autonomic nervous system. So I mention this just because there is a common misconception that long COVID kind of appeared out of the blue, but in fact, it is not unusual or entirely unique for an infection or a virus to create some sort of long-term symptoms or chronic illness. We've seen this with ME/CFS, with dysautonomia, with Lyme, and with other illnesses as well. But Lisa, I'd love to hear your definition as well.
Sure. Yeah. So I tend to state the World Health Organization's definition of post-COVID syndrome, which is basically another term for long COVID. You might also hear of PASC, which is post-acute sequelae of SARS-CoV-2. There's a lot of different terminology, but the patient preferred term and kind of what you see a lot in the press is long COVID. And this is the definition from the World Health Organization is symptoms that continue or develop 3 months after a COVID infection and last for at least 2 months, and there's no alternative diagnosis or explanation for these symptoms. So as Fiona mentioned, a lot of what long COVID is, it looks very similar to other post-viral illnesses or illnesses that have an infection onset. And in fact, what for ME/CFS, about half of people with long COVID are meeting the diagnostic criteria for ME/CFS, and about 2/3 have a form of dysautonomia. So there's a lot of overlap with other complex chronic conditions. And there's also a lot of people with long COVID have comorbidities that are related to these conditions, things like Ehlers-Danlos syndrome, endometriosis. So there's a lot of overlap with a lot of these complex chronic conditions. And in terms of prevalence, we're seeing that about 7% of all American adults right now are currently experiencing long COVID. So that's about 14 million people. That comes from the household pulse survey that the CDC conducts. And again, that's just adults. They only surveyed adults. We're still seeing prevalence in children for long COVID. And so that translates to about 20 to 30% of COVID infections leading to long COVID. So definitely a huge issue and something that a lot of people are experiencing.
I really appreciate you discussing prevalence and also bringing up the issue of children, because it really widens the net and the concern. So maybe, Lisa, you want to continue on and discuss why is long COVID sometimes described as a medical mystery? And then Fiona, if you have something to add to that, please do.
Yeah, so long COVID, I think took people by surprise, but it was people who didn't know about post-viral illnesses. And that was largely because of a lot of medical neglect and underfunding into research into these post-viral illnesses, things like ME/CFS, dysautonomia. As an example, in the years pre-COVID, the most funding per year that the NIH gave to look into ME/CFS was $14 million, commensurate with disease burden. So given how much ME/CFS impacts people's lives, if you looked at kind of like a graph of, and I should have actually just shared my screen and showed it, but if you looked at a graph that kind of measures how much funding goes into diseases based off of their disease burden, ME/CFS was like way down here, and it should be right here, which it was, $14 million down here. It should have been well over $100 million per year. So it's just severely underfunded. Only less than 30% of medical textbooks even cover it. So most providers are not aware of ME/CFS or of these post-viral conditions. And so it took a lot of people by surprise that COVID would cause these prolonged symptoms and could cause this type of outcome. But who it didn't surprise were people who have been experiencing this for decades and people who have been researching it despite the lack of funding.
And what I'll add to that is we also have to remember the context in which long COVID kind of first showed up, right? I got sick in March of 2020 in New York City. And as Shireen mentioned, I wrote what seems to be kind of the first mainstream media account of what we're now calling long COVID. That first wave of COVID patients who were able to document their infection, right? So people who were actually able to test for COVID during that first wave. It was quite a limited group because tests were so difficult to come by. I was only able to test because I was hospitalized, which is not necessarily a common experience for COVID long haulers. Something that I don't think we mentioned in our definition of long COVID is that it can stem from any sort of COVID infection, a mild COVID infection, a moderate COVID infection, even an asymptomatic COVID infection. And so we also have to keep in mind that at that period in time, there were a lot of people who were not hospitalized, who maybe should have been, or who did not receive care, who maybe should have. And so at the time that these COVID long haulers were first starting to emerge in New York City and, Los Angeles, and of course in Wuhan and Lombardy and all of these other places as well, healthcare systems were very overwhelmed by acute cases of COVID. And so a lot of patients were not able to get in touch with providers, were not able to kind of have these symptoms validated. And part of that was due to the lack of clinical education and research that Lisa has described, but part of it was due to, honestly, the chaos that we were all going through at that time. And unfortunately, this chaos continues to repeat seasonally, right? We're going through an intense surge right now. So if we think about, I know I see in the support group that there are long haulers that are right now having to put off healthcare as a result of the current surge, and either fears about reinfection or just simply not being able to be treated at an acute care center because of that healthcare overwhelm. So that's another factor that I think contributes to what people kind of call the mystery of long COVID. Just the fact that there were so many people who had to deal with this on their own at home, and we don't know what role that played as well in the exacerbation of symptoms, and continues to play in the exacerbation of symptoms.
Well, it also seems to underscore, point out an ongoing deficit in the medical commitment to researching post-viral illness, which I appreciate learning about. So you touched on this, Fiona, so maybe you want to continue. So what do you see as the factors that led us to being unprepared for the current long COVID crisis?
I mean, I think Lisa set the stage pretty well. A lot of it was a lack of research into and a lack of clinical education on infection associated and post-viral complex chronic illnesses like ME/CFS and dysautonomia. I think there's also an element of discomfort with chronic illness and sort of, our culture of reactive medicine as opposed to, a more kind of preventive medicine or holistic medicine, right? Just the nature of our healthcare system that silos people into seeing specialists for different systems of the body, that is affecting long COVID care today. And, the nature of that system certainly was not primed to be ready for long COVID patients. And it's harmed lots of other chronic illness patients as well. People in the ME/CFS community actually apparently used to sort of, darkly joke that it might take a pandemic to alert the world to these issues. And I think that's what we're seeing now, but unfortunately, we're not necessarily seeing the exact type of response that we'd want immediately. So I think those are some of the factors that set the stage, as well as of course, the chaos. I was actually just in another meeting watching a documentary as well about the disinformation and misinformation that took place at the beginning of the pandemic. So thinking as well about just how much mixed messaging people were receiving, and the fact that even today, there has been very little clear public health communication about the risk of long COVID. We still are not adequately preparing the public for this risk. And so our healthcare systems as well. I mean, I think people in support groups are still seeing doctors and healthcare providers who are unaware of long COVID or don't fully understand it. So the education still has not really gotten to where it needs to be.
Lisa, do you want to add?
Yeah, I would just say, I think with the long COVID crisis is not limited just to, someone's medical experience or their illness in and of itself. And we've been unprepared for the long COVID crisis in many aspects. So for example, with disability policies, with our social safety net, with our ability to accommodate people at work. There are many failures of our society at being able to respond to a mass disabling event like what we're experiencing right now. And so, like I mentioned, it's, not being able to, not having a real focus on accommodating people, enabling them to continue working, having flex time, for example, or enabling people to work from home if they need. We saw at the beginning of the pandemic that is possible, that workplaces can go virtual overnight. And yet we're still seeing people with long COVID being unable to get that approved as an accommodation now. We're seeing people that are not able to get on disability benefits despite having a disability that should qualify them. And that is due to a lack of funding in Social Security Administration. It's due to, frankly, just a lot of ableism, a lot of the medical neglect that we've already discussed. So it's, there's a lot of ways that we have been unprepared for this crisis, and it goes even beyond just treating the illness itself. It really covers every aspect of our society.
Let's talk about peer support. The goal of this book is to provide peer support in book form. But Lisa, do you want to talk about the role peer support in community has impacted you in your illness journey? And then we could hear Fiona's perspective as well.
Yeah, definitely. So I actually joined the body politic support group the day that Fiona wrote the New York Times op-ed, or that it, came online in April of 2020. And at that time, I felt completely alone. I was the only person I knew that was experiencing these prolonged symptoms after having COVID. I was promised by everyone that I would recover within a couple weeks. And at that point, about a month into my illness, was feeling much worse off than I was at the beginning. And so that support group really was a lifeline for me. I mean, I was desperate for information. I was desperate for finding other people that were experiencing what I was. And having that group meant so much to me and continues to mean so much to me. That was the birthplace of the Patient-Led Research Collaborative. That's where I found all of my co-founders, and all of those people now are like family to me, and they're really kind of the only people who understand my experience over the last nearly 3 years. So I think it's people who understand the experience of the illness, but also the isolation of having an illness during COVID, of having a new disability, understanding the medical gaslighting and neglect that we all experienced. I think there's just so much the role that peer support and community plays in our mental health, and being able to find resources, to know what tests to ask for at the doctors. It really has played a role in every aspect of my life. And now I'm lucky enough to be working full time with and for this community. So the body politic support group truly changed my life in so many ways. And I don't know where I would be without having had that. It definitely would have been a much more isolating. I wouldn't have received the care that I received. And yeah, it's just been life-changing.
Yeah, I mean, similarly to Lisa, my life has completely changed as a result of this illness, but very much as a result of that support group and the peer communities that have grown out of that support group. And in the long COVID community, as I mentioned, I got sick in March in New York City, and the whole city was, under siege from this virus. And it was a very scary time. After I was released from the hospital, I was basically in touch with one other person who I knew who had COVID, which was a close friend of mine who had, most likely infected me. She had been at my house before we knew to lock down, or that the virus was, that there was community spread in New York City. And as terrible as it was that she had infected me and that we were both quite sick, having that one other person to talk to and to text with, who was going through what I was going through and who could validate my symptoms. Unfortunately, she also was not getting better quickly. She also was experiencing symptoms outside of the very limited CDC symptom list. At this time, COVID was still very much being defined just as a respiratory virus, and the symptoms were quite limited to, fever and cough. So we were, of course, experiencing, gastrointestinal symptoms and neurological symptoms and dermatological issues and many other things that were not on that list. And we're really being told that those issues must be unrelated to our COVID infection. So having that validation was incredibly helpful. We realized pretty quickly that was invaluable, that relationship, that peer support, and that we wanted to give that to other people. And I'll be honest also that I felt incredibly helpless. I'm a New Yorker. My parents are New Yorkers. That is my city. And I was sitting there kind of watching the city crumble, feeling like I couldn't do anything because I couldn't get out of bed. And so the idea to start a support group or some sort of forum for people to connect just seemed like the best way to help. I did not realize at the time how impactful it would be or how many people would relate and connect. When I wrote that article that Lisa's describing, we had about 30 people talking to each other. And after the article was published, over 2,000 people signed up overnight to join our group. And this was only 4 weeks out from my initial COVID infection. So we had people joining who were saying, why am I not getting better? And that tells you something about the guidance we were getting at the time. We were being told 2 to 4 weeks for, a mild infection, and people were not better. They were, it was 3, 4, 5, 6 weeks for these people with mild infections, and they were not better, and they knew something was wrong. So I think that was really crucial. I do want to note that this was not at all the first peer-to-peer support group or the first, community effort of this kind. And I think we built a lot, and I ended up kind of going back in the archives and looking at, the HIV/AIDS movement and initiatives like the Gay Men's, Health Crisis Hotline, where people were answering questions from other patients, even the women's health movement, some of the ways that people educated one another about their bodies. I think the book Our Bodies Ourselves in some ways was an inspiration for this guide. So I was very aware of that history, and I think learned more about it through this process. But for me, the support group was like being in an isolation chamber and then suddenly going into a room filled with people all talking about exactly what I wanted to talk about. And so that was life-saving for me, especially at some of the darker moments. So similar to Lisa, absolutely life-saving, life-changing. And many of my closest friends are people that I met in that group, Lisa included, of course.
So you both gained a lot from support groups, and now you've tried to put some of those important lessons and that sense of connection and caring into a book. And can you talk about the motivation for doing that? Like, why is it important to have it in book form?
Yeah, so I think part of the, not everyone is going to go on an online support group. So that's the first thing, right? As great as these support groups are and as accessible as they are in some ways, right? You can log on from your bed, you can log on when you're feeling quite sick. They're not truly accessible because you need to have the technology to access them. And so it felt important to create, a paper guide that someone can hold and access even without a computer. I also wanted to, I think the support groups can also be a little bit daunting sometimes if you're new to long COVID. And so I felt that we could create something that could be a starting point for people who are completely new to this disease, either caregivers or people who are experiencing long COVID symptoms for the first time, or people who have been experiencing long COVID symptoms for a while, but are just kind of embarking on their journey of trying to access, care and support. And so I wanted to create a book that was a little bit more clearly organized. But finally, I think, we know that the internet, things on the internet can be fleeting. And I wanted to give us a chance to sort of bear witness to what we had experienced. So this book is one part guide. It is also one part memoir. It is a chance for us to tell our own history, and to hopefully provide somewhat of a blueprint to, whatever generations may come after us and fight similar battles in the same way that, I was going into the archives and looking at, the things that ACT UP and some of these other health groups had done. So that was sort of where I was coming from with regards to thinking about this book.
And Lisa, did you want to add anything to that?
I think so. Fiona approached me about writing a chapter for this book about a year ago, maybe a little over a year ago now. And I think many people had asked me, like, where's the long COVID 101 guide, and I think even now, people are still asking that. And so it felt very clear for a long time that something like this was needed. And I'm so grateful that it's out, because there is, the support groups have shared so much information. There's so much that we've learned from each other and from our own research. And so being able to compile all that we have learned into one place, like, it's even more than what you might be able to glean from a support group now, because it's organized in a way that is easy to read. It kind of, often feels like, the person that's reading it. I mean, I guess I do know many of the people that wrote it, but I think it's just like written in a very in a way that the people's voices, and you kind of become friends with them even through just reading the book. But it's also just a compilation of all this information and insight that we have gathered over the years. So it's really, I think, was really needed, and even adds on to the ability to have an online support group, because it really is information that's all compiled into one format.
I have to say, I really agree as a librarian with all your points. And people access information differently and in different times. And some people are more adept or more comfortable getting things online or participating in support groups. Other people like to quietly absorb or do both at different times. And 6-8 months ago, I was trying to purchase books on long COVID for the library collection, and really there was not a lot out there that you thought was reliable, that you'd want in your collection. So I really echo the need for this book and books like it. And I think the personal nature is really an important asset, that you do feel the voices are very accessible, very friendly. And I think that it speaks to bridging that gap of isolation, and that sense of I'm not alone. So I love the kind of synthesis of the need for support and the balance of really information and guidance. I think that really speaks to a lot of the needs that people are experiencing. So with that, maybe we can segue into survival tips that you might suggest to someone who has just been diagnosed or realized that they have long COVID. Fiona, do you want to start, and then we'll go to Lisa?
Yeah, so I think the kind of cardinal rule that is floating around in the support groups and that we all say to each other is rest and pacing. This is one of the main kind of symptom management techniques that long haulers, that's what we often call people with long COVID, long haulers and people with related chronic illnesses find helpful. One of the defining, or I'll say one of the characterizing symptoms of long COVID is called post-exertional malaise or post-exertional symptom exacerbation. It's the experience of symptoms worsening after exertion of some kind, either physical, mental, emotional. And so learning to recognize that pattern, if it's something that's happening for you, and then figuring out ways to essentially build in periods of rest, and pacing is kind of the term for, building in those periods of rest and structuring your day and your activities around that. that can be really, really helpful. At the beginning of a long COVID journey, resting as much as possible, I think, is something that, we advise with the caveat that we know that that's not super easy in a society where not everyone gets paid time off and sick leave can be difficult to access. And we all often have a lot of responsibilities, and we live in a culture that definitely prioritizes and puts a lot of value on productivity and being very busy. In addition to that, I would say, we recommend that patients track their symptoms. This is helpful so that you have information to bring to providers. It's also helpful so that you can track whether or not you are experiencing post-exertional symptom exacerbation. And in that same vein, it can be helpful to also track some level of activities or potential triggers, so that you have some sense of whether, exposure to bright light or sound or, physical activity is leading you to have a symptom flare or worsen symptoms, afterward, so that you can potentially avoid those activities or do them in more moderation. I also always recommend that when people are looking for providers, they seek out providers who have some level of expertise or experience in other post-viral conditions like ME/CFS or dysautonomia. POTS is a form of dysautonomia that many long haulers have been diagnosed with. Many have found it helpful to seek out a cardiologist, for example, who specializes in POTS. This is not always possible, but it is something that patients can ask providers about. Donna Kim Murphy, who is both a provider and a long COVID patient and a contributor to our book, writes that it's important to know that your provider should really be your partner in this journey. And if you are not finding that intellectual curiosity and that partnership in your provider, you have the right to fire them and look for someone else, right? Again, with the caveat that we know that access and privilege can play a role here. And then finally, of course, we've stated all the reasons why this book can sometimes be preferable to support groups. And I would say that this book is a great place to start. At the end of every chapter, there is a grayed out section of survival tips that you can kind of skip to for more of that logistical advice. But I think it is also helpful to join a support group. That's a place where you can ask questions, get questions answered. The Body Politics Support Group is a living archive of all of these long COVID anecdotes from spring of 2020, and it's searchable. So you can type in hives or topiramate and see every single person who has taken that medication or had that symptom and what their experience has been and what they have said about it. So those are my recommendations generally.
Thank you. And Lisa.
Yeah, those are great recs, Fiona. I think one of the things that I know in the survival tips in the book are covered in many of the chapters is knowing you're not alone and just remembering that. And I think that is a critical survival tip. Long COVID can feel really isolating. It's really scary, but finding community can make so much of a difference, as we've already discussed, and can really help you to know what to do next and, what steps you should take in receiving care or getting accommodations that you need or knowing your legal rights. So having that support is so crucial. And, I mentioned the numbers, there's 14 million American adults experiencing this. Like, if you are experiencing this, you really are not alone. But when we're, in our day-to-day life, and it can be really overwhelming and feel really isolating in the moment. So just kind of centering yourself and reminding yourself that you're not alone and doing that outreach to others, joining support groups, getting the book, talking to other people about it. Can really be so important. And I'd say the other thing something I think about when I think about pacing, which Fiona mentioned, is that pacing it's really hard to implement well and to implement into a life that may have looked very different before you got sick. And so part of, one survival tip I guess I would share that kind of goes along with that is really accepting your body for where it's at in the moment, and understanding that your life might have to look different right now than what it used to. And that's okay. And that is, we're going to try to find solutions and, things that can improve your quality of life. But being able to kind of accept where you're at in your illness can be really important in being able to pace and being able to alter your life in the way that it needs to be, being able to ask for help, because that is a huge thing, is knowing that you need a caregiver and asking for help from your loved ones and friends, and knowing that that's not a personal failing or anything. It's just where you're at right now. I think is a really important thing for people to understand and to accept about their situation.
All really important advice, I think. So thank you both for that. So do we know anything about who gets long COVID? Who does it affect? And are there some specific populations that find themselves more disproportionately impacted? Lisa, do you want to start with that one?
Sure. Yeah. So long COVID can impact everyone, which is not a satisfying answer, I think, to most people. But it's really all ages. It's, including children, as we mentioned. It's all genders, it's all races, all income levels, both people who are unvaccinated and people who are vaccinated with every booster. It's non-disabled people, it's disabled people. We really see it in every demographic group possible. Disproportionate impacts are to what we've seen in the household pulse survey data from the CDC is that women and transgender people are impacted more, and as well as the Latinx population. So those seem to be populations that are more impacted by long COVID for a variety of reasons. A lot of these illnesses that are related, so ME/CFS, dysautonomia, those are more common in women. So it's not that surprising that long COVID also would be. The Latino population, there's a lot of more cases of COVID generally. So it's also not that surprising that, there would be more cases of long COVID. But we still have a lot more research to do on, underlying mechanisms and biomarkers of long COVID in order to better distinguish kind of what may predispose you. But we do know it really impacts every type of person.
Fiona, did you want to add to that?
I'll second what Lisa's saying. The White House believe it or not, has said that the best way to prevent long COVID is to prevent getting COVID in the first place. So, which, you may not know, that may not be shown in their policies right now, but they have said that. So just to keep in mind that, of course, communities that have been hit hard by COVID infections, and of course, Lisa mentioned, the Latinx and Hispanic communities, and also there is, some research showing that repeat infections, COVID reinfections, can increase the likelihood of some of these, potential long-term issues. So thinking about communities that have been hit hard by infections repeatedly as well. Anecdotally, we do also sometimes see that people who end up developing long COVID sometimes did have, either a prior autoimmune disease or, as Lisa mentioned, a disease like Ehlers-Danlos, or a history of that in the family. But I will just mention that a lot of the patients that I know that have identified that have actually identified it after the fact, after developing long COVID. And I think it's important to note that because of the nature of our healthcare system and just the nature of the way that these diseases present, not everybody who is potentially medically vulnerable knows that they are. And at this point in time, of course, we definitely cannot say that long COVID is only affecting people with comorbidities or people who are medically vulnerable. And it does seem to be affecting people of all ages as well right now. So that's the only thing I'd add to that. The last thing I would add is There is also some research indicating that the antiviral Paxlovid may decrease the risk of developing long COVID if it's taken within, the first few days of an acute COVID infection. Some of you may have seen, some stories about the vaccine potentially preventing long COVID. We don't have reason to believe that the vaccine can prevent long COVID. There are vaccinated people who have still gone on to develop long COVID. But I just mentioned both of those things because those are topics that come up typically when people are kind of asking who's most affected and often wondering if there's a way to, prevent this or mitigate the risk.
So following up on that, can you discuss medical bias in treatment for long COVID? Fiona, do you want to start with that one?
Yeah, so medical bias, certainly existed before the COVID-19 pandemic. And when we talk about medical bias, we're talking about, some level of often implicit or, explicit bias that makes its way into healthcare settings, sexism, racism, homophobia. This became a pretty big issue during COVID, potentially because of healthcare overwhelm and people having to kind of make split-second decisions, but also, of course, because providers were presented with patients who were, presenting quote unquote mysterious symptoms or symptoms that did not fit a clear clinical definition that the provider already had. And so Karla Monterroso, who's not with us today, but wrote a chapter in this book. Her experience, for example, was one of going to, the acute care for difficulty breathing. And this is an experience that was shared among, I've read many stories of women of color in Los Angeles and New York City who sought care for, difficulty breathing, but unlike me, were turned away and told that, it was anxiety. And as Lisa mentioned, because there does seem to be a disproportionate impact potentially on women, we see this sort of gender bias play out a fair amount. It's not entirely new. This is an issue for ME/CFS patients as well. Jennifer Brea, who is the co-founder of ME Action, which is a ME/CFS advocacy organization, has made an excellent documentary that I highly recommend called Unrest, which gets more into kind of the history of gender bias in ME/CFS treatment, looking at, going back and looking at his cases of hysteria and the ways that, some of those cases may have in fact been ME/CFS as well as other complex chronic illnesses. So, medical bias has many different impacts, one of which is, of course, delaying care for patients. Shamir Smith is another contributor to this book who writes about her experience as a Black woman seeking care in Baltimore and being denied, again and again because her symptoms kind of didn't fit this clear clinical definition. There have been a number of Black women with long COVID who have also had difficulty seeking care because they've been profiled as drug users, which once again is not unique to long COVID. That is an experience that, Black patients have had before the pandemic as well. So when we think about the disproportionate impact of, COVID cases on some of these Black and Latinx and Indigenous communities, and then we consider the role of medical bias, it is quite concerning in terms of just thinking about how many patients may be going untreated for these symptoms.
Lisa, did you want to add anything to that?
I'll just say, I think, there's so much medical bias in basically all of that's related to all of the isms. So it's, ableism, people who are disabled are less likely to get quality care. So then they're often less likely to get quality care for long COVID. Fat phobia plays a big role as well. So there's a lot of overlapping kind of intersectional things at play that really stack the deck against people who have may identify with multiple marginalized identities. And I think that makes it all the more important for peer support and community support like this to fill those gaps. But ultimately, we need a better medical system that really tackles these health inequities and doesn't contribute to them, because we shouldn't be seeing these adverse health outcomes just because of someone's identity.
Well said. Thank you. So we're almost at the end of our discussion, and then we'll have time for questions. And I see that we're getting a lot. So Fiona, the last question for you, and you've touched upon it some, but how has the patient-led long COVID movement and the book, The Long COVID Survival Guide, been inspired by other health and justice movements from history? Do you want to expand upon that for us?
Yeah, so I'll just say briefly, once again, I think the patient-led long COVID movement is making history, and groups like the one that Lisa founded, the Patient-Led Research Collaborative, are redefining what it means to engage patients in research and really give them, decision-making power. But of course, I know that, Lisa's group and Body Politic and others are very much taking, lessons from past movements. The HIV/AIDS movement has, I think, been one of the more influential ones for us, just in terms of, and of course, that's an ongoing movement because HIV has in no way been solved in this country or abroad. But they HIV patient people living with HIV, really coined kind of the idea of meaningful involvement of people impacted by a disease in setting research agendas and being involved in policymaking. And so I think that's been a very integral part of long COVID advocacy. I also think that long COVID advocacy is deeply intertwined with disability justice and disability rights movements. And I think that's actually a pretty crucial part of the movement. We recognize that, this is not the first pandemic, likely not the last, and that, as Lisa mentioned, a lot of the issues that are coming up right now, while they may feel new, whether it's, with regards to social services or the ways that these diseases are treated, in clinical settings or research settings, are not new, and that there's a lot of work to be done to creating a society that is less ableist, and that, a society in which more people can participate and fewer people are sidelined, and in which disabled and chronically ill people are respected. And so I think that there's a lot of work happening, of course, with other chronic illness groups and with other groups like ME Action, this ME CFS organization, but also just with disability justice and disability rights organizations in general. And then on a broader scale, I think, a lot has happened in the past 2 years. Of course, there was, a pretty significant movement for racial justice. And I think all of this is intertwined. And my hope is that as the, long COVID movement moves forward, some of the economic impacts that are being felt by this community will start to push forward and, interlock with, some of the labor rights movements that are really gaining speed in this country as well. Because of course, we know that, once again, if we're thinking about who might be most impacted by long COVID, essential workers, frontline workers, those are many of the people who, may have been most impacted by initial COVID cases, reinfections. And so those sorts of, coalitions are going to be really important going forward as well.
It seems like very broad based network, yeah. And finally, Lisa, your chapter focused on research. I have to say it was phenomenally well written. As a research librarian, I was pretty tickled. So can you give everyone some tips for understanding research papers and avoiding misinformation? And additionally, are there any research studies that you're particularly excited about or recommend that people check out that are, look encouraging?
Well, first, thank you for that amazing compliment. I really appreciate it. I was so worried about my chapter, but so glad it's hopefully useful to folks. But yeah, if you have long COVID, the first thing I would say, if you're looking at a research study, is doing an internal gut check. Like, does this research study and what it's saying align with my experience? If it doesn't, that doesn't mean it's wrong necessarily, but that's a good indicator that something might be a little off. And so I think that's the number one thing. Oftentimes researchers don't ask the right research questions. They're not really basing their research, their methodology, what questions they ask of participants or what tests they're doing based off of patient experience. And so if it does feel off to you, it likely is. And, it can take a lot of practice looking through different research studies to be able to identify maybe where things are going off. But look at the research question, look at what they're measuring, what kind of questions were they asking and how did they go about measuring what they intended to. I think most of our interactions with research studies are usually through the press, through media, maybe through Twitter. And often those articles on research can kind of sensationalize the research or can focus in on one result. And so I really encourage folks to look at the actual research study that is being talked about in these press articles and on social media and see for yourself what the full results are, and really take a look at the study with a critical eye. If you can find someone that you trust online, that maybe is a leader in the patient movement, someone like my co-founder Hannah Davis, who often tweets about research studies and kind of the latest research, and is a good source for knowing if a long COVID research study or an ME/CFS research study is showing results that really reflect the patient experience. So trying to find folks like that you trust, if maybe you don't have the time or the energy to do a full analysis of the research study yourself. In terms of some things I'm excited about, so the Patient-Led Research Collaborative, my group, we established the Patient-Led Research Fund, which we just announced 9 research studies that we are funding into long COVID and ME/CFS. So this is 9 amazing projects. These were chosen by patients with long COVID and ME. And it ranges in variety from looking at microclots, looking at microbiome in the gut, looking at the pathophysiology of post-exertional malaise, and a clinical trial of low-dose naltrexone, which is a drug that has shown a lot of promise anecdotally for patients. So those are studies I'm really excited about, largely because we're funding them, but also because it's really, we really tried to prioritize what patients want to see in research. And I think we came up with a group of 9 studies that really do that. And I think will bring about a lot of answers for our community.
It's really exciting to have something to look forward to offer direction. Yeah, thank you. So we have a lot of questions and 4 more minutes. So we'll just try to get through a few. Could you just briefly describe ME/CFS? People weren't sure what that was. It came up a lot through the conversation. Would one of you like to tackle that?
Lisa, you want to take that one?
Yeah, sure. So ME/CFS it's a long name. It's myalgic encephalomyelitis. And then it's more commonly often referred to as chronic fatigue syndrome. But you could say ME or ME/CFS for short. And that is a neuroimmune illness where basically the main symptoms are post-exertional malaise, which Fiona explained a bit earlier, unrefreshing sleep, and fatigue. And it's an illness that about half of people with long COVID are now experiencing. It's a very short description.
I also saw someone asking, so I feel like this is an easy question to answer. Someone was asking about Iwasaki and Petrino as research. So I just want to shout out that Kiko Iwasaki wrote the afterword to this book. She's one of the leading researchers on long COVID. She goes into kind of the future of long COVID research, and Dr. David Petrino co-wrote our chapter on accessing and diagnosis. So both those chapters touch on the research, and yes, I saw that article as well that you are talking about, I think, and yeah, we get into some of the new research, but it is a book, and so we can't touch on everything that is brand new, but we do mention it does talk about microclots a little bit and some of the new research.
Okay, I'm going to skip over some of the very maybe individual questions about individual conditions, and see if I can jump to, do you know how long the antibodies from getting infected with the virus will keep us from getting another severe case? I've feel like that's been in the press. There's a little bit of variation in.
Yeah, I don't think anyone has a firm answer on that yet, unfortunately.
Yeah, that was my sense too. Lisa, did you want to comment or?
No.
Okay. Yes, the recording will be available within a couple weeks. I can answer that on the Marin County Free Library YouTube website. Someone who is 76 years old asks if there is any correlation, or are you aware of any correlation between age and recovery from long COVID?
We haven't done enough age-based analysis, unfortunately, but ironically, what we're seeing is that there's more prevalence of long COVID in ages like 30 to 50 is the most prevalent age group than folks who are older. But that could be because for a variety of reasons that we're not fully sure of. But so there isn't necessarily a correlation that we're seeing now.
I also want to note that age bias is something that people have experienced when seeking care for long COVID as well, being told, oh, well, you're just getting older, right? When you show up with symptoms of brain fog or whatever it is. So that may account for part of why we're not seeing as many stories of, kind of that stark, I was a young, healthy athlete, and then I got long COVID from that demographic, but it's hard to say at this point.
And I just want to, someone's asking for the link to the long COVID research group. And I thought maybe if you guys have a moment, you could put some links into the chat for the patient-led research collaborative, and then Fiona, the support group, and any other links that you think people would appreciate. And you can always reach out to me later. I created a list of long COVID resources that Lisa provided for me when Lisa gave the first conversation about long COVID about 6 or 8 months ago, and I'd be happy to send you that. That has a lot of wonderful resources all online.
I did see that someone was asking about accessing a paid caregiver through insurance providers. So long COVID, the White House has said that long COVID can be considered a disability. So basically you're in the same situation as, most other chronic illnesses that might qualify as a disability, where you can apply for short-term disability, you can apply for long-term disability, you can apply. There's a whole chapter in the book that I would highly recommend that goes into, other options through Medicare and Medicaid that you can apply for, and actually talks about the option of getting a paid caregiver through insurance. So I'd recommend looking into that. It's in the book. It's called With Disability Comes Rights. Again, it can be hard to access this stuff, some of it harder than other. It also depends on what state you live in and what the deal is where you are. But just wanted to make sure that folks know that you can request accommodations at work. You can apply for these benefits at a certain point in your illness.
I really appreciate that you mentioned that. I feel like there's not enough information about that in the public awareness. Someone is asking about their own condition. But I think it's relevant. So I don't know if you care to answer this, but the question is it recommended to push your HMO into authorizing an MRI, and will it show brain inflammation? And so this person, I think, is experiencing vertigo after 6 or so months. And even if you can't answer that question, I would really appreciate if you might bring up some of the points that Karla made in her chapter about documenting a physician's refusal to provide treatment. I think that people would really learn from that.
So I'll just say quickly, and then Lisa, if you have more specifics to this question, I'll just say quickly both that if your provider, and this is what you're referring to, Shireen, if your provider refuses to run a specific test on you, says that they don't think it's relevant or don't want to, you can request that they record that decision in your chart, the refusal to run that test. Often that will result in them just running the test because they would prefer not to record that decision in the chart, but it also means that you have that history of a provider, deciding not to do that. The other thing is that the book, the diagnosis chapter of the book, if you get the book, it's in the middle of the book, it has a table of tests that are recommended that you can ask your provider about. And these are, everything from, some of them are blood tests, some of them are, tests that you can do even at home to test for orthostatic intolerance and that sort of thing. So the book goes into a lot more detail. I can't go through them all now, but it might be a helpful resource for that. I unfortunately don't feel qualified to answer this question. Lisa, do you have any thoughts?
I also don't feel super qualified to answer that specific question without more information, but I will say that if you are able to get an MRI or able to get a test, if it comes back that everything is fine, that doesn't mean that everything is fine. A lot of what most people with long COVID are receiving a lot of normal test results back. And that does not mean that there is, nothing wrong with what's going on. Like, your body best. If you feel like your brain is still inflamed, it's probably still inflamed. It just might not be showing up on an MRI. And science hasn't gotten far enough to be able to show that. So I think just having that in mind, that the test results, it's more that, you might be able to find some answers. But if you don't find answers with those test results, that, don't stop looking and don't stop seeking care and treatment.
And I think maybe Fiona, you mentioned this, I can't remember which one of you did, but that one of the values of being in a support group is being able to crowdsource this information, say, I have these symptoms, I've tried these tests, nothing is working out, what do you recommend? And to learn from each other what might be advisable, what the next steps might look like.
Absolutely. Your peer community, I think, is your most helpful resource. And there's some advice in this book as well that connecting with local peer communities, which exist, both online and in person, can be especially helpful, because that's where you're most likely to kind of find out who the cardiologist is that everybody's going to and, feeling affirmed by, or who the neurologist is that, is running the test that actually is, showing some abnormalities. And of course, just for that validation that, yes, your test may be coming up clear, but as someone has mentioned, researchers like Akiko Iwasaki and David Petrino and Risa Pretorius and others are doing research that is showing that, if you run the right tests, there absolutely are abnormalities that show up for long COVID patients that indicate something is going on.
So if you guys want to answer one final question, we're getting some questions about anxiety and how do you deal with the anxiety of getting it again? How do you deal with the anxiety of going to places where people aren't masked? I think that's a relevant question. It harks back to our early conversation, Fiona, when we just started talking about, how open or limited is the world, and many people, have, quote, moved on.
It's hard. I mean, the first thing I want to say is, it's not just anxiety, right? It's anxiety that is stemming from a very real situation that is incredibly hard to navigate. And so I think for me, that's something I remind myself of when it feels like, why can't I just do this better? Why can't I just figure out a way to navigate this world better? It's kind of unprecedented and really, really difficult to do. Logistically, I personally do build my life around trying to avoid reinfection as much as possible. I think that a lot of us in the long COVID community, and those of us who consider ourselves to be, high risk for some sort of severe COVID outcome, do this in different ways. For me, it means, not socializing indoors and not going indoors without a high quality mask, and really curbing non-essential travel. And that's hard. And I'm not going to lie, like, it is really hard. And especially this time of year when I'm having to curtail things even more, and I want to be flying to the East Coast to see my family, and I'm not, it can feel kind of terrible. What has helped me has been being in community with other people who are making the same decisions, and being able to have that emotional support, get on a Zoom call or a FaceTime call, on Christmas morning, or, on Hanukkah with my family members who understand my decisions, or with, high risk peers who are making the same calls. And I think, in those moments where you're in the crowded grocery store and you are the only person who's masked, I try to just tell myself that, I'm doing everything I can. And I also try and remember that it can be very hard to avoid infection in this climate, and that it is not a personal failure to get sick. It is never a personal failure to get sick. I have a loved one actually this past week who got infected in a situation where they were wearing an N95 mask, and kind of had to, walk them through that as well, because I think the guilt can be really intense. And so, we do what we can. We fight for the mitigation efforts that keep our communities safe. And I think it's important, if there's anyone on this call who is an ally and can really bring those conversations up. It's hard to be the person saying that, asking if there's going to be masks, asking if the event's going to be outdoors, and we do the best we can. And I think having that community of peers who understands has really been the thing that has gotten me through those very tough moments of having to say no to something, or feeling extremely anxious about a situation, or feeling just completely alone.
And Lisa, how are you managing it?
Very similarly to Fiona, that was very beautifully said. And I think adding a bit onto that is how I deal with it is by doing this work, and by doing what I can to try to mitigate COVID transmission, by writing letters to my senators, by, really trying to do what I can to prevent people from getting long COVID, at the policy level, in addition to, my personal day-to-day interaction. So I don't know if that's the healthiest way to deal with, my worry of being reinfected, but, it feels productive at least. And I think there's all actions that we as individuals can take with contacting our representatives, and by having even those one-on-one conversations with people, explaining why we're making the decisions we are and encouraging them to do the same, that can really make a difference.
And I want to say events like these also make a difference. And for that, I'm very grateful to both of you for creating the book and all the work that went into that, and the individual work you both do to bring the information out to our governmental leaders and to communities such as ours. I mean, I think that is sort of circling back, a great way to deal with our personal fears of getting ill, is to just try to make the world safer. And so I'm very, very grateful to both of you for all of your work and for this evening. You shared a lot of information and a lot of enthusiasm and passion, and it's in a very incredibly difficult time for us at this point, I think, as a world community and individual networks. And so thank you for the work you're doing. And with that, I will share that other folks are thanking you too. And I am going to end this program for tonight, and look forward to seeing what you guys do next.
Thank you so much for having us. And thank you for the wonderful questions, everyone.
Thank you so much.